Hello everyone, this is Dr. Mossy. Today I'm going to teach you how to do the elbow examination. This is one of the most common teaching session in OSCE exam these days. So, as in every joint examination, we'll be looking at the joint, feeling the joint, moving the joint, and doing some special tests. So, before starting the examination, we need to explain the patient what we are going to do. So, we need to tell the patient that I'm going to look at your joint, I'm going to feel your joint, I will be asking you to move your joint and doing some special tests. Alright? So now we are going to start our examination. James, can you please come here for me? So we need to explain what we are going to do. The exposure, so we need to expose him above the elbow, and we need to examine in standing position. Alright, so now we are going to start. First of all, we will ask him to stand in anatomical position. James, can you please stand like this for me? Alright, so I will be looking in front of elbow for any redness, any swelling, if there is any changes in skin and any scar marks. Then I will be commenting on the carrying angle as well. Normal carrying angle is 5 to 15. If it is increased, this could be Klinefelter syndrome, and if it is decreased, this could be some kind of fracture there. Alright, after that I will be going towards the side of and back of the patient, and I will be taking the consent. So James, I am going towards your side. Again, I am looking for any redness, any swelling, anything there. Alright, so then I will be going to the back. I am going towards the back, James. And again, I am looking for redness and swelling, any rheumatoid nodules, and any psoriatic plaques. After the inspection, now I am going to feel. So, first of all, as in every palpation, we always start with the temperature. I will warm my hands and I will be feeling here the joint, the surrounding. Alright, so after checking the temperature, next tenderness. So I will be checking the tenderness. There are basically 3 to 4 points. I will be checking the tenderness. So first of all, I will check tenderness at lateral epicondyle, and I will be looking towards the patient's face for any pain. Then olecranon process here. Alright, then the medial epicondyle here. And then I will ask the patient, can you please flex your arm for me? And I will be feeling for the bicep tendon here. Alright, so this is part of palpation. Then I will be feeling for tenderness around the joint line as well. Alright, so this is feeling. Now last thing is moving. I will asking him to move his arm. Okay, next, can you please bend your arm for me like this? Now open it. Can you please move your palm towards the floor? Now towards the roof like this. So I have made 4 movements. This is flexion, this is extension, and this is supination, and this is pronation. Alright, yes, you can relax yourself. So after that, now I'm going to do some special tests, doctors. There are basically 4 special tests. One is Mills test and Cozen test. Both of these tests are for tennis elbow, lateral epicondylitis. Then lateral and medial stress test. These tests are for ligaments. Alright. So first I am going to do the Mills test. How to do the Mills test? James, I am going to place my hand here and one hand here, and I will be flexing your wrist, alright, and I will be straightening your arm. So I will be placing my one hand here on the lateral epicondyle, then I will be passively flexing his wrist like this, and I will be straightening his arm like this. So this is Mills test, and if patient is having any problem with the lateral epicondyle, the tennis elbow, patient will be having pain here. Alright, thank you so much. This is Mills test. Next test is Cozen's test. This test is again for the tennis elbow, the lateral epicondylitis. So now, James, can you please flex your arm like this for me? Now please make a fist, and now move your wrist toward your thumb. Alright, and I am placing my one hand here again on lateral epicondyle. I will ask him to press again my force, the extension. Alright, so patient will feel pain here on lateral epicondyle. This test again was for the tennis elbow. Thank you so much. This is Cozen's test. Thanks. So now I am going to do the last 2 tests, that is lateral and medial stress test. So first I will do the lateral stress test, that is for medial collateral ligament. So test means the opposite. Basically lateral is for medial collateral ligament and medial is for lateral collateral ligament. So what I am doing, James, can you please flex your arm for me? Alright, so this is lateral stress test, holding one hand here and moving the elbow outside. This is testing for medial collateral ligament. Moving it outside, patient will feel pain here if there is any problem with the ligament, that is medial collateral ligament. Next test is medial stress test, that is moving the elbow inside to check for lateral collateral ligament. Placing hand here and applying pressure, moving it inside. If patient feels pain here, this means there is some problem with the lateral collateral ligament. Thank you so much, James. Thank you. So I will finish my examination by examining one joint above and one joint below. Thank you so much. This is all from the elbow examination.